So we are going to discuss the use of various energy devices in laparoscopic surgery and how to use it carefully. So whenever we perform the laparoscopy, our main concern is that we should have the proper use of energy. So, energy is very important, and Thomas Edison has told that when all else fails, then energy is used, and especially the heat. Heat was used for a long time in the laparoscopic surgery to perform the surgery, and initially it was used as a, this cautery. Cautery was a direct current which was used to perform the surgery. But now we are using electrosurgery. Cautery is no more used, electrosurgery is performed. So this is the basic circuit of a monopolar current. We can see that we have this electrosurgical unit, and this unit has the frequency of 500 kilohertz to 3.3 megahertz frequency. This is the frequency allocated for electrosurgery. If you will use less frequency, less than 100 kilohertz, then muscle and nerve stimulation ceases. And then what will happen, that patient will have a twitch of the muscles, and patient will have electric shock also, because our household appliances, they work with the less than 100 kilohertz frequency. And laparoscopy, all the electrosurgical generator which you buy should have 500 kilohertz to 3.3 megahertz frequency. This is the frequency which is better for performing the laparoscopy. Now, burn is equal to intensity of the current into time by area. In laparoscopic surgery, whenever we use electrosurgery, we should avoid burning. And burning happens if the heat increases more than 100 degrees centigrade. So we should try to take care that intensity of the current should not be more than 40 watt. If 40 watt is the ideal intensity of the current which we should use in most of the laparoscopic surgery. Time also should not be more than 3 seconds. Like suppose you want to coagulate uterine artery, then uterine artery take 9 seconds time to get properly coagulated. But it should not be a continuous 9 seconds, because if you will give continuous 9 seconds, there will be burn, and burning will create a lot of smoke, and that smoke actually is bad, because if the temperature is more than 100 degrees centigrade, then coagulated elastin and collagen that get burned. How the coagulation happens, that at 55 degrees centigrade protein coagulates, and coagulated protein shrinks, and once it shrinks, the lumen of the vessel also shrinks, and at 80 degrees centigrade there are two chemicals inside the cell, that is the elastin and collagen. Collagen, as you know, that it is a tissue binding protein. So at 80 degrees centigrade, elastin and collagen also melt. But if the temperature is more than 100 degrees centigrade, then this melted elastin and collagen will burn. And once it burns, it becomes like a burnt charcoal, just like a tip of a burnt cigarette. And then it can drop anywhere and bleeding again started. So how to optimize it? That you should take care that your time of the application in one go should not be more than 3 seconds. Like suppose you should hold a uterine artery or cystic artery or any artery and activate in one go maximum 3, like 10, and then stop. Once you stop, again temperature drops down less than 100 degrees centigrade, and again you can reactivate. So in one go, time should not be more than 3 seconds. And area, in one go, area should not be more than 6 millimeter. Because if you will hold a big area, you will have remote injury. So it is important that area also should not be more than 6 millimeter, and especially in monopolar, because monopolar creates a lot of remote injury. We can see here that gynecologist is performing the tubectomy, but a big area of the naked part of the hook is touching, and that area is more than 6 millimeters. So what is happening, that this fimbrial end of the tube is touching the bowel, and this bowel will burn here. This is an example of remote injury. So remote injury is a big problem of the monopolar. So why this problem is happening? Because if you will attach a big surface area more than 6 millimeter in one go, then any other small area will create burn, and that burn is called remote injury. Remote injury means injury beyond the field of application, and this remote injury is a big problem. We can see here the surgeon is performing cholecystectomy and this CBD is burning. Why? Again, this is example of remote injury. Sometimes remote injury also happen when your patient table is uninsulated or arm is touching metal part, or if you have a patient table and if your pad side location is bad. Like whenever you apply the patient return plate, you should choose well vascularized muscle mass. We should avoid a vascular insufficiency area. You should also avoid irregular body contour and bony prominences. Like here you can see the orthopedic surgeon has applied it on the condyle of the femur and you can see the burn. You should also consider the incision site, means the patient return plate should be applied as near as possible to the application site. Like suppose you are performing surgery of the breast and axilla, then you should apply on the arm. If you are performing the surgery in the groin region, you should apply on the thigh. And if it is nearer to the application site, it will have no injury. If you will use a less small size, you will see the injury. This is also one example of remote injury. You can see here that surgeon has attached the patient return plate on a bony prominence of the condyle here on the calcaneum, and because it is a bony prominence, so it will do the injury. So why this injury happens? Because you have the naked part which is attaching a less surface area. Minimum we have to be careful that 100 square centimeter area must be in the contact with the patient return plate. These all type of injuries are electrical injury, which happens because less surface area is in contact. So whenever you will apply, minimum 100 square centimeter area should be in the contact. We can see here two pictures. Here a small area is in the contact and it has a burn. But here we can see big surface area in the contact. So patient return plate is here. The heat will be only produced at the application site. But here we can that heat is also produced at the exit site. So size of the patient return plate should be bigger and it should be in the contact with the floppy body mass, floppy muscle mass, so that minimum 100 square centimeter should be in the contact. That means 10 centimeter into 10 centimeter, or it may be 5 into 20 centimeter. 20 centimeter. That also will make the 100 square centimeter area. Then patient return plate should be safe. Now, bipolar doesn't have this problem because in bipolar the current travel only in between the jaw. So in bipolar burn happen, equation of the burn is bipolar is intensity of the current into time. Area is not a problem. So in bipolar, remote injury doesn't happen. Because in bipolar, even if you will hold a full jaw area, remote injury doesn't happen. Because in bipolar, positive and negative go together. And current can only travel in between the two jaw. So that's why it is safe and we should maximum try to use bipolar. But bipolar has its own problem. One of the problem of the bipolar is that it has relatively more collateral damage. Collateral damage is lateral spread of the heat. So in bipolar, positive and negative is very nearer. So if you will apply for long time, collateral damage will be more. Second, that only few instruments are bipolar. And third, that normal bipolar doesn't cut. It does not cut. So these are the three drawbacks of the bipolar. If you want to cut with the bipolar, you should have very high frequency electrosurgical generator. Normal frequency bipolar doesn't cut. Like here we can see in this picture that if you will see here, my picture is visible, that I have few instruments which is bipolar, and I am going to demonstrate those instruments. So this is called bipolar Maryland, that is called robotic dissector. How you will recognize? You can see it has a plastic joint. You can see there is a yellow color joint and both the jaws are apart. So bipolar can be easily recognized because it doesn't have a metal joint, because metal joint both the jaw will get short circuited. So you have the plastic in between to keep insulation, and it is two wire going on the back. You can see there are two connectors. So this is called robotic dissector. This is bipolar Maryland. After that, this is bipolar grasper. Here also you can see both the joints are apart from each other with the plastic here, and this plastic is keeping it away. So the advantage is it doesn't get short circuited and current will flow only in between the jaw. On the back also you can see there are two connected because it is bipolar. Another instrument is the bipolar forceps. Here also you can see only tip is uninsulated, and inside both these are fully insulated. There are two jaws here, but you can see this black part is fully insulated. Only this metal part is uninsulated. And on the back you have two connectors. In the lab we will demonstrate you all the devices, all the instrument, and once you have the last day you will have the animal dissection in the lab of the Florida. So in US also we have permission to do your animal dissection, and you will use this bipolar that day and it will be performed. So this is the bipolar forceps. After that, this is the bipolar hook. You can see here there are two joints, two hook, and in between there is a insulation. If you see carefully, in between there is a insulation. So basically there are two hook together and current only travel in between the jaw. And on the back again you can see there are two connectors. Exactly same way we have a bipolar shearer. So this way bipolar has only few instruments. By default all the other instruments are monopolar. So these are few of the problem of the bipolar. Like the scientists, they have tried to make the bipolar seizures. In this seizure only tip is metal and here it is plastic. So what happened, if both is metal, it gets short circuited there. So bipolar has to be especially designed. And bipolar generally, if you will buy less than 500 kilohertz frequency of the bipolar, then bipolar doesn't cut. You have to coagulate and you have to cut with the seizures. If you will buy the high frequency bipolar like radio frequency bipolar, which has approximately 1 megahertz frequency around, then it will cut. Like 4-strand, RB or PK gyrus, that bipolar will cut. But normal bipolar which we are using in our OT, that doesn't cut. So these are the three drawbacks of the bipolar. First drawback is that it has a relatively little more collateral damage. Collateral damage is lateral spread of the heat. Second is that we have a limited number of instruments. And third, it doesn't cut, you need to bring something to cut. But bipolar has one big advantage, that it doesn't do the electrical injury. So here we can see this is a simple appendectomy surgery, and we can see here that this is the appendix which is held, and it will be applied the bipolar here. So this is the appendix, this is the major appendix, and here this is a simple Maryland which is making a window, and then you will bring the bipolar forceps and coagulate the major appendix. After coagulation, you can see the tissue color initially become white, then it become yellow, and then it become brown. We should avoid the tissue becoming black. And once it is coagulated, you will see bubbling of the water, and then it is cut by the seizures, because it will not cut its own. And again you have to bring the bipolar and again coagulate. Time here also, in one go you should not apply more than 3 seconds. Otherwise collateral damage will be more. So we can see here this whiteness is collateral damage. and you will coagulate and again bring the seizures to cut. So in the bipolar, collateral damage can be minimized by short, a small burst. You should not give a big continuous activation, and you have to bring a seizures to cut. But one of the big advantage of bipolar, it doesn't do the remote injury because active and return electrodes are together. Now there are many type of waveform. First waveform is pure cut. Pure cut is a high frequency low voltage current. In that 100% of the frequency is given by the electrosurgical generator. Our ESU, that is electrosurgical unit, is 100% on. That is called pure cut. And then you have a pure coagulation. In pure coagulation, our electrosurgical unit is giving only 6% on, 94% it is off. So it is a high voltage, very low frequency current. So in the cut, what happened, that frequency is so high that tissue get evaporized, tissue get burst, and due to that entire cytoplasm will fracture, and due to that fracturing of the cytoplasm, it is giving you way, and that giving you way of the tissue is called cut, because frequency is so high that there is a turbulence of ion inside the cell, and due to that tissue get evaporized, and this is called cut. Because why it get? Because of maximum frequency, high frequency. But you should not give a big contact. Direct current, direct contact should be avoided, and you should try only to brush over the tissue. Another is, we have seen here that another is coagulation. In coagulation, tissue will not burst out. What happened, that frequency is so low that heat inside the tissue increases. And once the tissue increases, heat is go to 55 degrees centigrade, then protein will coagulate. And at 80 degrees centigrade, elastin and collagen, elastin plus collagen will melt. And due to melting of the elastin and collagen, lumen of the artery will seal. That's why tissue is still present. But if your temperature increases more than 100 degrees centigrade, then this burned elastin and collagen will start producing a smoke. You know, sometime a student is asking the question to the professor, that professor, when I am performing surgery, a lot of smoke is coming, what should I do? And what professor will answer, that in that situation, you should try to put a suction and try to suck the smoke. Actually, this is a wrong answer. The correct answer is, we should not produce a smoke. If your temperature is within 100 degrees centigrade, only vapor will come, bubbling of the water will be visible and vapor will become. If tissue become dry and temperature become more than 100 degrees centigrade, then only a smoke comes. And if a smoke comes, that means tissue is burning. And if tissue is burning, your coagulation will not be achieved, you will have more bleeding. One of the most common cause of bleeding of the uterine artery, cystic artery, renal artery, splenic artery, mesenteric artery is overcooking, not undercooking. So that's why we should take care that we should not allow the smoke to come out. And that is coagulation. You will press the blue paddle and it will coagulate, because frequency is very low, so tissue will not burst. Now we have blend mode also. What is blend? Blend is a mixture of cutting and coagulation. Blend 1 is more near the cut and blend 3 is more nearer the coagulation. So blend mode is required when you have the vascular tissue. Now where it is used, suppose you are doing salpingotomy or salpingostomy or pyeloplasty or CBD exploration or Heller's myotomy. In those situations you should use pure cut. Why should you use pure cut? Because we don't want margin to have a burned tissue. And in the pure cut, what happened? The tissue which is touched is evaporized, but tissue which is untouched is healthy. So when you will suture it, it will heal without fibrosis, and it will have a good healing. It will not have a, this stricture. So that's why it is necessary that we should use pure cut in those cases. Now, if you are using for the vault opening, like in the hysterectomy or myomectomy or partial nephrectomy or liver resection, then you should use blend mode. Because if you are opening the vault in the hysterectomy And if blend mode has little coagulation component, then the margin will not bleed, and then your vaginal angles will not bleed. When you have a deep intramural myoma, then you should use blend current, so that muscle will not bleed. And uterus or the vault can tolerate little fibrosis. It can tolerate little stricture. So in that we should use blend mode. And when you have an active bleeder like uterine artery, cystic artery, then you will use pure coagulation. So cut and blend both is used by the yellow paddle. Basically pure cut and blend cut, these are the type of the cut. So one is pure cut, other is blend cut. Same way, coagulation is also of two type. One is called fulguration, another is called desiccation. What is fulguration? Fulguration is a coagulation current with some distance. And in case of fulguration, voltage become very high, so current can jump in the air and it can throw over the tissue. So what happens? The depth of injury is very less and width of injury is more. And that is used for some time for the endometriosis, or you have a oozing. In those situations you can use the fulguration. Like here we can see this is a endometriosis case, and here this is a spatula. This instrument is called a spatula, and this is the spatula, and a spatula is doing the fulguration, and this is a case of endometriosis fulguration. And in these cases of endometriosis, what is the advantage of using the fulguration? That depth of injury will be very less, width of injury will be more. But you have to ask your nurse to change the machine to the fulguration mode. And fulguration has only superficial burn, it doesn't go deeper. So even if you are over the ureter or around the uterosacral ligament, nearby structure will be safe and you will not have the much deeper injury, and that is called fulguration. Another type of coagulation is desiccation. Desiccation is a coagulation current with the firm contact. Do you know these all buttons are there on the machine? When we will perform the wet lab in the our last day, then you will see and we will demonstrate you that in your machine you have all the button of coagulation, then desiccation, then fulguration, then pure cut, then blend cut. So you have to select it the appropriate mode, then only it will have the optimum. So desiccation is the coagulation current with the firm contact, and in desiccation depth of the injury and width of the injury is equal. If you want to decrease the depth of injury, you have to decrease the timing. And once you decrease the timing, then depth and width or both will decrease together. In fulguration, width is more, depth is less. But in desiccation, width and depth more, both is okay. So desiccation is used for vessel. What happens in desiccation? That water content of the tissue will evaporate, and we can see these dots are coagulated protein. And once the protein will coagulate, then the tissue will shrink. And once the tissue will shrink, then temperature go to 100 degrees centigrade, 80 degrees centigrade, and at 80 degrees centigrade, elastin and collagen of the tissue will fuse together, and that we know as a hemostasis. We can see tissue is fusing together, and that is sealing the vessel. So whenever you have an active bleeder, you should use desiccation mode. In desiccation mode, your active bleeder will fuse, and then it will have the proper hemostasis. So what are the variables impacting the tissue effect? We should use the correct waveform. You know, today you did the hysterectomy, you may not have a bleeding, and tomorrow you did it, you have a bleeding. Why it happened? Because our correct waveform was not selected. Like your coagulation was set for fulguration or desiccation, and you don't know, your nurse has pressed the fulguration or spray mode. Spray mode is also a type of fulguration. And then you are trying to coagulate the tissue, then it will not coagulate. Lumen of the artery will burst out and you will have more bleeding. Exactly same way you want pure cut and your machine was set to the blend cut. So we should be careful that correct waveform has to be selected. After that, power setting, we should not go more than 40 watt. However, this depending upon your generator type, but normal Covidian force effects and normal standard USA FDA approved generator, they need maximum 40 watt. We are not inside the abdomen to celebrate firecrack. If you feel that your genital is giving a smoke or you are getting a lot of charring, power setting should be decreased. Size of electrode: when you want to cut any structure, you should use finest instrument, and if you want to coagulate, little bigger size is required. Then time already we have seen, we should not be going more than 3 seconds, maximum 3 seconds in one go. And after 3 seconds, you should open the jaw, take it out, and again catch it. Why open the jaw and take it out? Because it should not stick with the tissue. So timing is also important. Manipulation of electrode. What happens that whenever you have to cut any structure, like you want to do salpingotomy, you want to do the the vault to cut, you want to cut the peritoneum anywhere, you should stretch little bit. Without stretching, cutting will be very difficult. So manipulation of the electrode is important. That's why during colpotomy we push the colpotomizer. That's why during cutting the peritoneum we stretch the peritoneum. And whenever you want to coagulate, you should not stretch, you should relax the vessel. If the vessel is overstretched, it will not get coagulated. So how you manipulate the electrode, that is also important. Then type of tissue which has more water content, we should use less wattage. Like suppose you have a mesoappendix, or you have a fallopian tube, or you have any mesentery, or you have a this sleeve gastrectomy, and you are taking short gastrics, you not need much wattage because those has a fatty content. And tissue which is harder, like ligament, tendon, like uterosacral ligament or fibroid, you need more wattage. So type of tissue also important. And last variable is scar formation. What happens that when we use 5 to 10 minutes, the burn particle get deposited in between the jaw. And we should take a ball of the hydrogen peroxide, we should dip that into the hydrogen peroxide, and with the sponge or gauze piece we should clean it. Because if a scar is over, then you will have the burn tissue which act as an insulator, and it doesn't allow current to go to the tissue, and that will affect your coagulation. We can see here two pictures. This is a fused lumen. Fused lumen means temperature was less than 100 degrees centigrade, and melted elastic collagen is nicely fused. And this is the burn lumen. You can see here also bleeding is not happening because of proximal thrombus. But post-operatively, if BP will fluctuate and this proximal thrombus will dislodge, bleeding started. So always we should try to have the fused lumen, we should not have the proximal thrombus. So this is also important. Now we will discuss some of the advanced energy sources. One of the good advanced energy sources is argon enhanced electrosurgery. In that what happened, argon is a conductor of electricity, argon gas. So here the argon gas is discharged, and due to argon gas, it will improve your fulguration effect. Normally fulguration you cannot do from 1 or 2 centimeter, but with the argon beamer, even if you are at the little distance, you can do. So argon beamer is very useful. Here you can see this is uterus, and here we can see this is the round ligament, and these are the fulguration happening on the endometriosis, and this is the argon beamer. What is the advantage of using it? That there will be no deeper injury. We can see this is bladder, and even if you are over the bladder, it will not perforate the bladder, because argon beamer only does superficial burn, it doesn't go very deeper, because it increases your efficiency of fulguration. So it is very useful for endometrioma, for presacral neurectomy, for liver resection, and wherever you have a oozing, because it will make a thin film of coagulum and it will keep the bleeder behind. So this is very useful. It is also used by urologists and general surgeon. Here we can see on the right side, this is an argon beamer which is used in the cholecystectomy. We can see there was a bleeding from the liver, and this argon beamer is coagulating all the bleeder, and because it doesn't produce a smoke, because it displaces the oxygen from there and it cannot drag the tissue. So this is the cholecystectomy, and all oozers are stopped. On the left side we can see this is partial nephrectomy, and after removing the partial kidney, here it is getting burned. And what is the advantage? Right now there is a hemolock. But once you will remove the hemolock also, or bulldog clamp for the partial nephrectomy, then also oozing will not happen. So organ beamer is very useful in the laparoscopic surgery for the fulguration. After that, we have many another energy sources available. One of them is called tripolar. Tripolar is very useful because it has, mechanical cut, because in normal bipolar we have already discussed that normal bipolar doesn't cut. So advantage of this is called tripolar. We can see here it has a bipolar. Actually it is a simple bipolar with cutting blade. You can see here there is a blade coming, this blade, and from where I am pushing this button, if you will see, when I am pushing it, a blade comes out here, and this blade will cut. This is just, you open bipolar, catch it and just press this, and once we press this, you look at this, here a blade comes, and we don't need to bring seizures. And this is a simple instrument which can be attached in any generator. You don't need an advanced generator. Any simple generator also will do that, and you can use it. So this is called tripolar. Tripolar is used to minimize the time. Tripolar has an advantage that you don't have to spend a lot of time. So this tripolar is also available, and people are using it to perform the surgery. Advantage is that you will not have the, to bring the seizures. We can see here, this is a splenectomy video, and this is the splenic artery, and this is a tripolar which is coagulating couple of times this artery, and we can see these are a small burst. You will not activate it for a long time. So multiple small application is always better. We should never apply. Tripolar is basically a bipolar with a cutting blade inbuilt. And then once it is coagulated, you can see during coagulation no any traction is given, because once you give traction it won't coagulate properly. And then we can see after coagulation there is a blade coming, and this blade will cut. So your instrumentation time will decrease. You don't have to bring repeatedly the seizures. Otherwise you have to apply bipolar and then bring the bipolar out, and then you have to bring the seizures. So this is a bipolar seizures, and it is a bipolar with a cutting blade here, and this blade is actually, that's why company is saying it tripolar, but it is a mechanical cut. There is nothing like a third pole in the world. It is basically the blade which they have given the third pole name. That's why it's called tripolar. So it will dissect also, it will grasp also, it will do the bipolar coagulation, and then it cuts with the blade. Another instrument which is very useful is harmonic scalpel. Harmonic scalpel, during your last day animal dissection in the Florida, we will give you the harmonic scalpel to see how it cuts. It has a 55,500 vibration. So it disrupts the hydrogen bond, and then it cuts. 80 to 100 degrees centigrade only heat is produced, and it is less collateral damage. So it is very important. Here we can see that this is the transducer of the harmonic, and in this transducer you can attach any instrument you want. There are harmonic hook. This is harmonic hook, and this hook can also be attached. Here I am just attaching this hook, and it will work like that. And then you can use for colpotomy, you can use it for hysterectomy, cholecystectomy as a hook. After that, if you don't want this, you can detach it. Then you can use harmonic ball. This is also very good for the fulguration. But remember, harmonic is a mechanical energy, it is not an electrical energy. What happens that inside this transducer there is a piezoelectric crystal, and once the current go to the piezoelectric crystal, it vibrates, and that vibration go as high as 55,500 vibration per second, and due to that vibration your instrument vibrates, like it vibrates, and due to vibration it produces the mechanical energy. After that, you have the, suppose you want to do vaginal hysterectomy or LAVH or open surgery, then you have a harmonic wave. This is called harmonic wave. You can see it is written here, that harmonic wave. This harmonic wave also you can attach with the same transducer, you can attach, and then you can apply it like that. And then you have to tight it 2 times. Like after fixing it, there is a tightener, and this is 1 and 2. It will give you 2 click, and after that you can use it. Here we can see it is written minimum and maximum. This is minimum, this is maximum. Minimum, in minimum you can set your vibration even as low as 15,000 vibration per second, and it can increase 1, 2, 3, 4 like if you want. Maximum is always set to 5, and that is used for cutting. Basically minimum and maximum, why it is written? Because it is not a current, so they don't write cutting and coagulation. Maximum can be used as a to understand as a cutting mode, and minimum for coagulation. But actually cutting and coagulation is not alone. Here whenever it cuts together, it coagulates also. So it can coagulate the vessel up to 5 millimeter. You have for laparoscopy, most important instrument is harmonic ace. This is called harmonic ace. What is the advantage? The tip is longer and 5 millimeter. As we know, in the harmonic we need longer instrument, and here also you will tighten it with the transducer. Here I am tightening it, and after tightening you will just tighten it 2 times, and here this is 1 and 2, and it is done. So this way, and here you have a 2 jaw. One jaw is called Teflon jaw, another jaw is vibrating jaw. So you have to always careful that this Teflon jaw should be towards the sensitive part, and only this vibrating jaw is active. That you have to be keep in mind. So it is basically a mechanical energy. Harmonic is not a electrical energy. Of course electrical energy is inside the generator, but over the instrument you have the mechanical energy which is working. So it has less collateral damage and less tissue necrosis. Another is, this is the hand piece of the harmonic, which has a piezoelectric crystal to vibrate, and then it is a basically ultrasonic energy which works. So in harmonic you have the hand activation as well as foot activation. This is the Teflon jaw, which is inactive jaw, and one jaw is vibrating jaw. And this vibrating jaw is basically putting a mechanical energy, and that mechanical energy will produce heat. Maximum heat produced in the harmonic is only 80 degrees centigrade. These are the various type of instrument which is available in harmonic, like harmonic ace, harmonic wave, harmonic hook, harmonic ball. You can use it even in the open surgery if you have this generator. And one of the biggest advantages is that you don't have to worry about the remote injury. Collateral damage is only maximum 2 millimeter. You can see this is the salpingo-oophorectomy. This is the IP ligament, and this harmonic is working. And always take care that this Teflon jaw should be towards the sensitive area. Like if you are near the bowel, then Teflon jaw should be towards the bowel. If you are near the vessel, Teflon jaw, and always the vibrating jaw should be visible. And that is important. This is the vibrating jaw that should be always kept under vision. If it is out of the vision, then it has also adaptive tissue technology. Means according to the hardness of the tissue, it increases its force. If you are working on the hard tissue, it will automatically increases the force. Just like the automatic transmission of a car, if you are going on the height, then car will automatically change the gear, because it is automatic transmission. So exactly same way it has adaptive tissue technology. And nowadays it is must having instrument, because if you don't have harmonic, then you are bound to use monopolar, because without harmonic, monopolar will be required to do the myomectomy, to do the hysterectomy. And as we know that monopolar has one of the big problem of remote injury. And monopolar, only few instruments are there with the monopolar. Monopolar has remote injury, can happen in the ureter, can happen even in the part of the body. But if you have a harmonic, you don't need to have monopolar. Even if you want to do side to side anastomosis on the bowel, then you can perforate the bowel with the harmonic. That is safe. But take care that harmonic, when you are using, there should not be a lot of stretch. You can see here the mistake surgeon is doing. He is stretching, and once it is stretching, sealing will not happen and tissue will bleed. Here you can see surgeon is doing the mistake that he is holding partial, so that also will bleed. Here the surgeon is doing mistake that vibrating jaw is touching the bowel. It should be upside down. Teflon jaw should be down, vibrating jaw should be up. Then this perforation would not have been occurred. Here also you can see that this Teflon jaw is touching the vessel, and then it will puncture. So these are the few mistakes which we should not use if you are doing harmonic. Now coming to the LigaSure. LigaSure was a very good invention by the Covidian, and Covidian previously it was with the Valley Lab, but now it is in the Covidian. So advantage is basically it is a tissue response electrosurgical generator. It is called tissue response electrosurgical generator. In layman term, we can understand that it talks with the tissue. It keep on coagulating the tissue, and once the elastin and collagen started burning, it stops. Now the question is how it talks with the tissue. That is called impedance technology. What happens once the water content of the tissue started evaporating completely, impedance of the tissue changes, and then it will sense it and it stops. So why it is better than ours? Basically it is a bipolar, but it is an intelligent bipolar. Why? Because in our own hand with the bipolar sometimes we overcook, and LigaSure will not allow it overcooking, and that's why it can seal the vessel up to 7 mm. And it is a bipolar, so there is no chances of remote injury. It has a unique energy output, so it doesn't burn, and because it doesn't burn, it only coagulates. That's why no sticking, no charring, and you not need multiple application. In one application it will do the job. So nowadays LigaSure is essential for the like hysterectomy and all. We can see this is a hysterectomy surgery. This patient has multiple myoma, we can see, and here this is a fallopian tube. Round ligament is above, and right side this is LigaSure, left side this is Robi dissector. And it gives the, if you see here, it will only give you vapor, it will not give you black smoke, and the collateral damage either side is only 2 mm. 2 mm collateral damage. So this is the advantage of the having LigaSure, that collateral damage is less and it creates less burn, and it is sealing it very nicely. You can see the margins are nicely sealed, and that make this instrument essential. So LigaSure is basically a bipolar, but it has a activation, and it works very nicely for the vessels up to 7 mm of vessel. We can see here that this is the LigaSure, and it is by Covidian, and it has an advantage that just you can hold it, and once you lock it, it get locked, and once you press second time, it leave the tissue, and then you keep on pressing by the thumb, and as soon as you press, then it will give a sound, and then as soon as this, and a blue ring will run on the generator, and as soon as tissue is cooked, it automatically stops. You don't have to stop it. And once it stops, then this is the blade. You will pull it and it will cut. So it has a cutting blade in between, and that automatically cuts, and then you can open it. You can rotate the jaw. So you can see when I am rotating, the jaw is rotating. So, and it is just, you have to press it, this button, and as soon as you press it, it start activating, and once tissue coagulated, it automatically stop. However, if you want next time, then again you can press next time, but normally if it is new, then in one time it will do the job. So LigaSure is a advanced energy sealer, and that has an advantage that it will cut also and it coagulates. So this is LigaSure. Ethicon has launched the same like Ensil. This is called Ensil. Ensil has a one more advantage, that it is articulating. You can articulate in any direction. This is also bipolar with the cutting blade. But Ensil is less popular because LigaSure is a better brand, and they are famous for the vessel sealer. So you can see this blade is progressing. And if you will buy Gen 11, that is the new generator, then Ensil you can get free. Another is Thunderbeat. What is Thunderbeat? It is basically a mixture of the vessel sealer and the harmonic both together in the same generator and same hand probe. That is from Olympus. So basically it is a mixture of the LigaSure and harmonic. So we all know that the ultrasonic energy, that is the harmonic scalpel using ultrasonic. Ultrasonic is the fastest in the class for cutting. But it doesn't have so much good coagulation, but we know bipolar is the best for coagulation. So in this instrument, both is together. You don't have to change always the instrument. It has a bipolar and ultrasonic energy both. You can see these two jaws are acting as a bipolar, and this lower jaw is vibrating, so it is cutting by the harmonic. It doesn't have a blade to cut. It cut with the ultrasonic energy and coagulate with the bipolar energy. And it also has a impedance technology, so once the tissue will coagulate, it will stop. So this is Thunderbit, and that is basically patented from Olympus, and if you will use it throughout the surgery, you don't have to change the instrument. The same instrument can be used for cutting, same instrument can be used for coagulation. How does it cut? It cut with the vibration, that is mechanical vibration, by the ultrasonic vibration. And how it coagulates? That is by bipolar, because bipolar is the best for coagulation and ultrasonic energy is the best for cutting. So this is the Thunderbit that is also available and you can buy it. Now we should also keep some safety consideration. There are a few mistakes which we do in the electrosurgery. One is overshooting, overcooking, direct coupling, insulation failure and capacitive coupling. Overshooting means your tip of the instrument is going beyond the field of application. Like here we can see that this is the surgeon is doing the iliac vessel lymph node dissection by the hook, and hook is not a good instrument to use because hook is monopolar, and hook is not a good instrument to use near these type of dangerous vessels. That's why it is called triangle of doom. And you can see this is a hook is overshooting, because in laparoscopy we work on the lever action, and outside the instrument is called, and you can see it is perforated, and there may be very dangerous situation. Now you have to open the abdomen. That is the example of overshooting. After that, overcooking. You can see here this is uterus, this is uterus here, and this is the uterine artery. But surgeon was so afraid of bleeding that he has completely burned, and this is completely burned, and now he is trying to cut it by the scissors, and you will see because of this overcooking, and it will start bleeding, and we can see it is. So this is overcooking is also one of the mistake which we should not do. And you know, this frantic attempt to go more lateral and catch the bleeder, this is how we sometimes burn the ureter. So this is also should be avoided. Another problem is direct coupling. Do you know, you should never bring any active instrument near the monopolar. Like suppose you are using hook, you are using Maryland, you are using grasper, and if you have any uninsulated instrument, like here it is a suction instrument, and this suction instrument is touching here, and this suction is touching the bowel, and bowel will burn. That is called direct coupling. Direct coupling is a big problem that we should avoid. Sometimes your hook may touch the telescope and it can burn. These type of direct coupling examples are a lot. Like here we can see that this telescope is touching, and here this orange is just to show you the experiment that this orange is burning. Why? Because telescope is also a metal and it is an uninsulated instrument, and if it touched by the monopolar, it will do direct coupling. After that, insulation failure. We should also check that any insulation should be checked. If there is an insulation failure, you can see it can burn. And this type of insulation failures is very dangerous. So all the instrument we should check it. Like I will show you here, you can see this look. This is a hook. Looks like very good, very nice. There is absolutely fine. But you can see here that there is a small burn here. And this burn can kill the patient. Why? Sometimes it happens that sometime your nurse is using the chillet forceps from side X-ray and from somewhere to lift chillet forceps, and that chillet forceps will make a cut, and that is dangerous. That can create a big complication, and the patient can have the irreversible damage and it can burn. So this also must be avoided. This type of insulation failure, this is your duty of the nurse. We should train our nurse that they should always very nicely, they should select and they should try to avoid this type of burn. Insulation failure, you can see here, this is scissors which is used, and there is insulation failure and it is burning at this point. And these type of burns are dangerous because it will not known to you. Your patient will come third day with the perforation, because this type of perforation generally we don't see. Here you can see this is the uterus, and here sigmoid colon is burning. So this type of insulation failure is dangerous. Now the last problem what can happen in electrosurgery is called capacitive coupling. Capacitive coupling happen if you have a inside metal and outside plastic. If both are metal, it is good. If both are plastic, it is good. But if you have an inside metal, outside plastic reducer or plastic cannula, then it is not good, because your inside reducer will become like a capacitor, and it will attract the electrostatic current, because there is a lot of electrostatic current is generating. We can see this tube light is not attached with any wire, but it is lighting, because a lot of electrostatic current generate, and we can see it is burning. So inside metal and outside plastic is also dangerous. That is called capacitive coupling. You should also take care that if it is both are metal, then any electrostatic current which will form, it will go to the abdominal wall and then return to the patient return plate. But if inside is metal, outside is plastic, then it will go to the bowel, and that can burn the bowel. So this also, you should avoid mixing the metal with the plastic. Now, to prevent these problems, there is one good thing, that incision, one company has made one AEM technology. AEM called active electrode monitoring technology. This is endosealed device. It is a small adapter, just like our MCB. That is a miniaturized circuit breaker, which we are using in our house. Same way, this is a device. One side you will attach to the machine, and other side you will attach to your instrument. And once it will attach to the instrument, if instrument is good, automatically it will give you green light. If it is bad, it will give you red light. If suppose you are doing direct coupling, or if you are doing any of the insulation failure, there will be surge, and once there will be surge of current, it will break the circuit. So basically it is used as a circuit breaker, which we have the miniaturized circuit breaker in our house, which we are using whenever any fault is there, MCB is tripping, same way it will break the circuit. So it is called a burn protection system. And that has an advantage that it can be attached to any machine. Regardless of the machine, you can attach it, and if anything goes wrong, it will break the circuit. So advantage, you can also use it to prevent. However, it is not available in every country, and it is a small company, so they could not market in a big level, because, and it is their patented technology. So due to that patent, it is not available with a bigger machine also. You have to attach this extra device, that is called incision, and that is a type of burn protection system which we should use, and using it will create some safety. Now, we should also take care that we should not apply monopolar, especially when we have the pacemaker to the patient, because it can affect your programming of the pacemaker. We are also at danger, because we can also burn ourselves if we are a part of circuit, or your gloves is broken, your hand can burn. And in the smoke of the abdominal cavity, once we use electrosurgery, viral DNA, bacteria, carcinogenic material, and irritants are available. There was one study in which it was saying that laser and electrosurgery both produce a lot of, this is laser and this is electrosurgery, they produce a lot of carcinogen. So we should avoid directly inhaling them, because it has an irritant also and carcinogen also. So we should use the smoke evacuation system, and you should suck the smoke nicely. So ultimately, this is the recommendation, that we should inspect the insulation carefully, especially if you are using reusable instrument. If you are using disposable every time new, then it is okay. Otherwise, we should use lowest possible power setting. We should not use more than 40 watt. Use a low voltage waveform. Cut should be used more than coagulation. Use a brief intermittent activation. We should not use continuously for long time. Do not activate in open circuit. What does it mean? You should hook plus look and then cook. Means without touching the tissue, you should not try to activate it. And what are the things you should look? First, after activating, you should, first thing what you should look, more than 6 millimeters should not be held in one go. Second, you should look, the direction of overshooting should be towards the anterior abdominal wall, so that when it overshoot, it will burn the peritoneum, not bowel, not the bladder, not the diaphragm. third, what to look, third thing, that when you want to cut, stretch, when you want to coagulate, relax. And fourth, which paddle you should press. For cutting, press yellow, for coagulation, blue. So always hook, look and cook. Without hooking, do not activate, otherwise it will burn. Do not activate in close proximity to prevent what? Direct coupling. Because direct coupling will happen if you are very near to the other instrument. Use bipolar whenever appropriate, because bipolar doesn't have remote injury. Select an all metal cannula system as the safest choice. Do not mix hybrid cannula system which mix metal with the plastic. Why? To prevent capacitive coupling. And if you can use, then utilize the available technologies such as tissue response generator or AEM technology. AEM is active electrode monitoring system. So if you have these advanced system, then your chances of this problem can be minimized. So this way I try to just cover the maximum part of the electrosurgery, how to use, and we will demonstrate you this machine also during our dissection. So thank you, Dr. Solomon. And if there is any question from them, I will like to explain.
Yeah, sure. Is there any question? ¿Hay alguna pregunta? ¿Sí quedó claro? Is everything clear?
Okay.
If everything is clear or not clear at all?
Thank you very much. If there is any question, I can answer in the next lecture also. Thank you.
Okay, thank you, sir. So next lecture will be tubal surgery for gynecologists.
Yes, after 45 minutes.
Yes, sir. Yes, 45 minutes.
Okay, thank you. Have a nice day. Thank you very much. Thank you.
Thank you.